Thank you, Dr. Nandana. And after the first presentation, I'm so glad that I'm doing pathology. I don't have to remember all those numbers and things. Yeah, so all of you can relax and listen to this presentation. There's nothing to write down. Most of it is common sense. And actually, when I started preparing this presentation, I was thinking what to do, and quality, safety, and professionalism is a big topic. So I decided to go down the route of professionalism more than quality and safety, but I will touch first about quality and safety. Um, so my name is Gayathri Wathuge, and I'm consultant cellular pathologist and the clinical director for the Pathology Service delivery unit. So in our hospital, the pathology unit is cellular pathology, biochemistry, microbiology, and mortuary. So I manage these 4 units as the clinical director with a multi-million budget actually. So it's a very difficult task. And when I started doing when I thought about doing this one, actually I'm doing this presentation on behalf of PEMSA UK, and this is in collaboration with PEMSA and KSM very kindly who gave me this platform to talk today. So my first 2 slides are about PEMSA UK. PEMSA UK is a non-profit, charitable and non-political organization working closely with PEMSA to support the Faculty of Medicine, University of Peradeniya, and its undergraduate and postgraduate students. This presentation today is part of sharing experience and expertise program that we have with PEMSA. My presentation and my topic basically is on behalf of PEMSA UK. And before I start, I want to also mention, because there are medical students and I hope there are postgraduate students as well, we have this PEMSA UK Academic Award. It's open for submissions now, and the closing date is 31st of August this year. For undergraduate students, we have 2 awards. First one is £250 cash prize, and the second one is £150 cash prize. For postgraduate students, there is 1 award, but it's given in 2 halves. The first one is given is a £300 cash prize when you win the prize, and the second £300 is given on submission of a follow-up project, publication, presentation, or if you're attending a course. So the total is £600. So if you're interested in applying for these, applications are now open and the closing date is 31st of August. And for further details and how to apply and the criteria, you can visit our website, which is www.pemsa.uk. So with that, let's go to the presentation. So why I chose this topic? I'm a cellular pathologist. If these days, if I want to do a pathology presentation, I think the hot topic in pathology is on digital pathology and artificial intelligence. That's what we are doing in UK, in my hospital right now. And the medical profession and the things are advancing in a direction that our surgeons are doing robotic surgeries and the pathologists are doing digital reporting using artificial intelligence. But I think it is going to be of no interest to most of the people who are sitting here today. So I thought I will choose a topic that will be of interest to a lot of people in the audience. The topic is a very important one, and it's very much talked about in the UK. I don't know how much relevance and importance given to this topic in this country. While talking about this topic, I have no qualifications to talk about this topic. I have no expertise in this topic as well, but I have experience in this topic. I've listed a few things that I've been doing for the last 13 years in UK and more than 11 years as a consultant in UK. I've done so many leadership roles, done various other things as well. During these things, I had to go through a lot of training, and through which I learned so many things, and that's what I'm going to share. I've been the lead, I'm the lead pathologist for cervical screening program for the diagnostic cytopathology, gynecological pathology, and the other things that I do, I'm an educator, I'm a GMC registered educator and educational supervisor. So I have a lot of experience in teaching and training postgraduate doctors. Dealing with doctors and difficult trainees and things like that, I've done a lot. So I think I've learned a lot of things through these things. And I've been the Oxford Deanery Training School lead for many years, and I've sat in ARCP panels, which are the annual, end of year appraisal kind of thing for trainees. Cervical screening program lead when in 2019 when the NHS transferred to the primary HPV testing. So dealing with these things, I've met lots of people, managers, the quality people, working with them, all those training have helped me to give this presentation. And I'm also examiner for Royal College of Pathologists. Examiner training is another thing that teaches you a lot of things, how to deal with patients and trainees and junior doctors. Currently the head of the department in cellular pathology, and I also take Sri Lankan MTI trainees every year. I'm also the clinical governance lead, and currently the most challenging one is to be the clinical director for the Pathology Service Delivery Unit, which means that I'm dealing with non-medical people, managers, divisional directors, chief operating officer, and the chief executive. So medical and non-medical people. So I think I'm sharing this experience with you all. I can't ask anyone to follow this, but if there's anything that you think is helpful, you can take it from this presentation. I think that's the idea. So I will briefly go through quality, safety, and professionalism, and the reasons for lack of quality, safety, and professionalism that I have seen, and the effects and how or what we can do about these things. So quality, the definition of quality is doing the right thing for the right patient at the right time in the right way. And all these things are to achieve the best possible result. It sounds very simple, isn't it? And quality in healthcare, the WHO definition is the degree to which health services for individuals and populations increase the likelihood of desired health outcomes. And it's based on evidence-based professional knowledge and is critical for achieving universal health coverage. So I don't know if this makes any sense to you. So let's go a bit more detail into this topic. A quality health service should be effective, safe, and it should be patient-centered. So what is safety of a patient? Patient safety is the avoidance of unintended or unexpected harm to people during the provision of healthcare. You just had a presentation of anaphylaxis based on the previous experiences, recent experiences. So safety is to minimize patient safety incidents like those that happened and drive improvements in safety and quality, and patients should be treated in a safe environment to protect from avoidable harm. So how can we deliver safe patient care? We have to build foundations of safer culture. If the culture in your department or in your ward is not safe, it's really difficult to have or deliver safe patient care. So that culture needs to be changed in the first place. And you have to develop safer systems. And for you to do that, you have to support the staff. One thing is to have insight into what they are doing, to get them involved and show them how to improve. And to do that, you have to improve the skills. For example, if it's an injection, if the person is not skillful enough to give an injection, you have to give them that skill. So more training, and for them to be more confident in what they are doing. So all these things are important in delivering safe patient care. So that's briefly about quality and safety, and there is a lot more that I can go into detail about safety and quality, but I'm moving from that. I'm going to go to professionalism and how professionalism is going to affect quality and safety of patient care. So what do we understand by professionalism? When I thought about this one, I thought about dress code as well. So does the dress code matter really? You can see in the picture that there are two doctors very well dressed in two different ways. I don't know what your opinion is, and I don't think there is a right or wrong answer here as well. So does the dress code matter? And being a professional doctor, does that mean you have to dress well? Is that what it means? I think to a certain extent, yes, you have to dress properly. Because if you come to a department like me being a pathologist, well, I have colleagues who come in shorts to work. Does it matter? No, it doesn't matter. Well, if I go to my department in a bikini, it's a bit inappropriate, isn't it? So to a certain degree, just what you wear matters. I think more than that, how you present yourself to a patient, if you are a surgeon, and if you go to a patient with your hair messy, your nails dirty, and things like that, it's not going to give them a good impression about you. So to a certain extent, how you present yourself physically to a patient matters, but more than that, how you behave in front of a patient is what matters. So the definition of professionalism means how a doctor should look as well as behave. And the more important thing is, even when you're faced with challenges, it's easy for you to behave in a normal way when you don't have challenges. You're having a good day, so you can talk to everyone nicely, your team, your other colleagues, the nurses and the other workers, and the patients. But on a day, you're having a bad day. You had a fight with your partner, you had house problems, and you're obviously not in a good mood. And you come to work, what some people try to do is to take it out on other people, right? And that is where the professionalism comes. Yes, we are all human beings, but it is not an excuse that you had a bad day at home that you come and take it out on students or on nurses or the other people. So the challenges we have in day-to-day work, we have these in UK as well, you have these in this country as well. I think all of us have all these problems. Sometimes you don't have enough time with the patients, so you are stressed. You don't have enough or adequate facilities or staff to do the work that you need to do. Or it could be personal issues that I mentioned, like your personal life problems or your social issues. So these are the challenges we face every day. And if you bring all these things into the workplace, that is when you're going to behave in an unprofessional way. And I found this one very interesting. This is Medical Council of New Zealand. It says, as a doctor, you have an obligation to be respectful and professional, as your behavior may affect how a health team functions, how care is delivered to patients, and the public's trust and confidence in medical profession. So when I listen to news actually these days, if you listen to Sri Lankan news, almost every day, doctors and hospitals are a hot topic. And then so many people talk to media about various things. And every time you speak to media and newspapers or whatever, you have to remember that you are representing your organization and your profession and yourself as well, and the consequences of those things. So there was a study that I found about professionalism, and then they asked, what things do you think make up professional behavior in a doctor? And in this one you can see about like 1/4, 26.4% of people said humanism is one of the main important things a doctor should have. We shouldn't forget about these things. We should not be robots treating patients. What are the good human qualities that a doctor should have? We all know. I don't think I'm telling anything new here. It's all the things we know, but either we are forgetting these things or we don't have time to think about these things. As we all know, being kind, being caring and compassionate is what patients need. 1/4 of patients said having empathy. These are the qualities that patients expect to see in a doctor. Do you give these things to your patient? Next one is communication. It could be in your government sector or in private sector. We also have a private sector. So do you treat patients equally? Do you communicate with your patients well? How do you communicate? Communication has to be a two-way process. And if you don't let the patient speak to you, that is not correct. And if you are the only person talking to the patient, you can't get the information that you need, and you don't give the opportunity for the patient to talk to you. So communication is very important in building the relationship between you and the patient. So you have to give time for the patient to talk to you. The next one is accountability. So you have to be responsible, you have to be accountable for everything that you do. And other things included ethics, look at clinical competency and excellence, they are minor components in this study compared to humanism, communication and accountability and integrity. So all these things make up a good professional. If you go on GMC website, there are a lot of things. There's so much information about professionalism, good medical practice and things like that. As we all know, we all need the knowledge, skills and attitudes. We need to maintain confidentiality, and in the UK this is a big area. I'll show you at the end. My last slide shows how many doctors lost their GMC registration because they couldn't maintain confidentiality. So you cannot give your patient's information to other people if they are not related to the treatment of that patient. You cannot go to media and talk about patients. You cannot give information to newspapers like that. Confidentiality is one of the main things and trainings that you do when you are in UK especially. It's a very important thing. You cannot talk about a patient if the patient's treatment is not related to that other person. You have to respect personal beliefs. So being a pathologist, I do breast MDTs, I do gynecological and so many. There was this patient in the breast cancer MDT who had a breast cancer. So she was offered by the MDT surgical treatment followed by chemoradiotherapy, and she denied the treatment. And her reason was that she was a Catholic, I think, and she said, I don't want to have treatment because if I'm going to die, that is my destiny, and I don't want to change that by taking any treatment. So if I'm going to die, I have to die. That I have to accept that. So there was this patient who denied all the treatments. You have to respect their belief. But in an MDT, if the patient denies a treatment like that, what we do is we document that in the MDT notes to say that we offered this treatment, but the patient denied. This is to avoid any sort of legal issues later in time that the patient can come and tell, I had a breast cancer, you didn't treat me, and now I'm in this situation. So you have to document all those things, but you have to respect personal beliefs. And also to be honest in financial and commercial dealings with patients. In UK, we are not allowed to accept any gifts or presents from patients. You have to be honest to your employers. So when we are doing private work, especially, so in UK we have things called job plans. So in my job plan, I have to declare all the private work that I do with other organizations to my main employer. And at the end of year, we have all these appraisals. For the appraisal, I have to do external practice forms from all those private providers, 1 or 2 or 3, because it's important for the main employer to know that my practice in other hospitals is also up to standard. I'm not under investigation in any of the hospitals for anything. So every year we have to get those external practice forms signed by the director of those private organizations, and the appraisal is done by the main employer. So you have to be honest, you have to declare all that information, who you are working with, and all those issues that you have to the main employer. If you don't declare that, and if you're found, then that's a question of honesty, integrity. You can be taken down the disciplinary road. You have to be honest with insurers and other organizations and individuals. So honesty is one of the main qualities that a professional doctor should have. The other thing is treating your colleagues fairly and in a respectful way. So if you have worked in UK, in the first couple of days when you do the induction, you have to do a whole lot of trainings. One of the things is a policy that you have to read through is dignity and respect. The way you would like to be treated, everyone else also would like to be treated. Because you are a consultant or a doctor, you are no superior than anyone else in your department. Superior than a nurse or a laborer. They all have the same dignity and respect. They all deserve to be treated in a respectful way. And if you are treating them in a bad way, you are abusing your power or your position as a consultant or a doctor. And that's not right. And make sure your conduct justifies your patient's trust in you and public's trust in the profession. So moving on to unprofessional behavior, I found these are all Google images. Lots of things we don't think too much. So if you are a consultant, and I don't know who these people are, but I'm assuming they're all doctors, colleagues, but you can see from this picture, you can't hear anything, but look at the facial expressions, look at the body language. One person is pointing a finger at the person in front of them, and the other two are also look at their facial expressions. So it's not only what you speak to a person, it's your body language and your facial expressions. They all mean something. And if these are students, if you are giving a feedback, and your feedback is one thing. When you're giving a feedback to a student or a junior doctor, you should not give negative feedbacks, because the studies have shown that negative feedback is not going to help anyone. So when you give a negative feedback to a person, that demoralizes that person, it's not going to help that person. So what you should give is a constructive feedback. And if you give a feedback like this in front of so many other people, you are humiliating that person. The person is going to feel very upset, maybe even cry. And you don't want to put a person in that situation in front of the others. This is equal to bullying and harassment. So if you have to give a feedback, I think a constructive one, not so positive feedback, I think you have to give it in isolation, because you don't want to humiliate a person in front of other patients, nurses, and all, because every person has their own dignity and you have to respect that. These are two colleagues, I believe, and what they are doing. This is all, you can't hear what they are doing, but you can see the body language. You can see the mouth wide open. They're arguing. So arguing in front of others is another thing. In UK, even if you raise your voice a little bit, it's not taken in a good way. Arguing you can't do, because if you argue with somebody, that person is going to go and complain about you anyway. So these are unprofessional behaviors that we should avoid at all times. You can always discuss. There are problems, but you have to discuss in a professional way. You argue and you fight with people when you put emotions into it. So when you're doing your job, you have to take your emotions out of it and talk through things in a professional manner. So unprofessional behavior. So some of the unprofessional things that people do. People can get angry. People can be threatening other people. Can be yelling at people. Publicly degrading team members. Intimidating staff, patients, and colleagues. Pushing, throwing objects. There are examples in UK. The reason I started with doing this presentation was as also earlier this year, there was the breast unit academic day, in which one of our plastic surgeons, a breast reconstructive surgeon, did a very nice presentation on midlife crisis, one whole half an hour presentation on midlife crisis. And he gave real life examples of surgeons throwing objects at people in theaters and things like that. So some people can do that as well. And you can outburst with anger. You can do physical abuse, hitting people, using swearing words. So these are the things that we should not do. So these are more sort of aggressive behaviors, and then you can also show your passive, unprofessional behavior. Things like chronically late to work, failure to return calls, failure to answer emails. And in UK, we use emails most of the time. Now, when I go back to work after 3 weeks, I will have millions of emails to go through, but still I will take a couple of days to start from the bottom to answer, to make sure that I answer each and every email and I attend to all those things. Otherwise, it's very unprofessional for me to ignore someone and not respond. And when you also reply, even in the written language on emails, people need to carefully choose their words. And you have to carefully think about the tone, because the person who receives the email can take it in a very different way. So you have to carefully choose your words and your tone in your email as well. And emails, remember, not like the words that you say. unless they are recorded, or a video recording these days people can do. Email is a written thing. They can use it against you for complaints and things. And I've seen so many complaints. Junior doctors complaining about consultants, investigations, colleagues complaining about colleagues, investigations. So these are real life things. Inappropriate or inadequate charts if you are a doctor that you have to maintain. So these are passive things. It's not coming to you as an aggressive way. You can just avoid meetings. Chronically, someone is not coming to board meetings or something like that. You don't just participate, you just avoid. Chronically, you don't go to lessons if you are a student. And you are ill prepared or not prepared for the day. So these are passive unprofessional behaviors. And then you have the passive aggressive one. Hostile notes, emails, derogatory comments about institution, hospitals or groups, inappropriate joking, sexual harassment, complaining and blaming. These are very serious things, and people can use these things against you as well. And because I was told that there will be medical students, I found this one. I think it's very tiny. I can read it. For medical students, you don't have to wait until the day you become a doctor to become professional, because professionalism is something that you take with you. It's in you. It has to be in you, that you carry it throughout your career and you take it forward when you become a doctor. So as a medical student, if you are failing to engage with your work, it's unprofessional. If you are dishonest, that's unprofessional. Poor self-awareness and disrespectful behaviors are also unprofessional. So starting from your training days, you can avoid these things and train to become a professional medical student, and then you will become a professional doctor. I just wanted to touch upon bullying and harassment, which is a big topic in UK. So bullying in Oxford Dictionary means a person who uses their strength or power to frighten or hurt weaker people, like vulnerable people. So you feel like you are superior, you're a consultant, and you find the laborer a weaker person, a vulnerable person, and you don't hesitate to shout at that person. It's so easy, you think. And harassment, it goes with bullying, and it's again intimidation, threatening or coercive behavior, including the speech and the words that you use. It usually happens from a superior, like a consultant or a doctor, to a junior person, a nurse or somebody, because you think you are more powerful than them. Are you actually more powerful just because you are a consultant or a doctor and the others are nurses, laborers and other people, or patient? Patient can be just a very uneducated person from a village, or patient can be a lawyer sitting in front of you. You don't know who they are. Sometimes you know. They will react in different ways. So just your profession doesn't give you any power than any other citizen in the country to bully or harass them. And it depends on how they take it as well. Some people may just take it, okay, Dr. Banna, and then there are the other people. If the patient is a lawyer, will go and file a case or a bullying or harassment thing against you. So it depends on your patient or the person you are bullying and harassing as well, and it's a very serious thing. Trainees, undergraduate students, postgraduate students can get bullied, and they can complain against you as well. And this is a picture that shows, look at the two people. The lady is keeping her head down and looks like she's helpless, she's vulnerable, and this person is using the power against that person. So she will stay like this, but she can also go and put a complaint against bullying and harassing her. Why do health professionals behave unprofessionally? It could be the stress, as I mentioned previously. You can have stress in your personal life, in your professional life. You can have hundreds of excuses to behave unprofessionally. It could be that you are unable to cope up with your pressures. It could be you are overworked. Well, overworking is sort of a choice that you make. if you're working full time in the hospital, and then you're working in the private sector until midnight the next day morning, you haven't had enough sleep, you can easily lose your temper because you're overworked. But why does that happen? Can you change it? But in UK, there are flexible working patterns, and I don't think it's available in this country. So you can pick if you're overworked, it's you have to realize that I'm working too much. I have to reduce this because this is affecting my personal life and my family life. So I'm going to go down to 3 days a week, 4 days a week, or I would reduce my private practice or whatever. Some of the things are under your control. Some of the things are not. You could be just, as I mentioned earlier, going through various phases in your life, because we are all human beings. We are doctors, but we are also human. Midlife crisis. It's not a joke. It happens to people. When you're reaching that age, like I'm in that middle age, you become like a more established consultant, and you know that you are a senior person. And you tend to think like, okay, I know everything and everyone else doesn't know anything, and I am the best. So these are the things that you start thinking. Menopause can affect, and I think personally, I was affected by menopause last year. I couldn't sleep properly in the night, and it affects me. And if it affects my work, then I have to, first you have to realize and understand, yes, I'm going through this phase in my life, and it's affecting me. It's affecting my work. I have to do something about it. So when I realized, I decided that I needed some treatment. So I started on HRT, and it's actually helping me. So I think first thing is to have insight. What's happening to you? What's going through in my body and my mind? If you don't realize, then you're not going to act on it anyway. Some people just have egoism, ego. The more senior you are, you'd have this ego. You don't want to listen to anyone because I know everything. I am the best, that sort of thing. That's also harmful, and that's unprofessional. I think in life, whatever your age is, every day there is something that we can learn from, even a child, even a student, even a postgraduate student. So there is no end to learning, and we should be open to that. And we should not ignore other people just because they are junior to you or they know less than you. So what happens when you have this unprofessional behavior? Like if you had a fight with someone, it could be verbally, not physically. Are you happy after that? You shout at somebody. Maybe at that moment you enjoy that. You shouted at a laborer. Yeah, I feel powerful. I'm a consultant, so I shouted at that person. You feel pleasure in doing that for a moment. And then you go through the next phase, like you regret that. Why did I do that? That poor person. You lose your peace in your mind. You raise your blood pressure. You raise your stress. It's not going to help your physical health or mental health. You lose the dignity and respect from the others. If you do that in front of so many other people, you just lose respect that you earn from other people. It can lead to official complaints, investigations, disciplinary actions, and you can lose your job. And in UK, this is real. So that's the personal things. If you behave unprofessionally, what will happen if you behave unprofessionally in a team? In a hospital work, it's always a teamwork, isn't it? You can't say that I saved the life of that patient. I don't think that's right, because it's never you who saved the life of a patient. It's a team who contributed. It could be one person dominated, but it's a team. You're always working in a team. So if you behave in an unprofessional way, your team is going to be dysfunctional. There will be conflicts. You can't work as a team. There is no trust. So the whole department or unit becomes dysfunctional. And this happens it happened in my department a couple of years back. The consultants had problems. It was again related to a bullying and harassment complaint made against one consultant by the postgraduate trainees. So when a department becomes dysfunctional, it's really difficult, especially in my specialty like pathology. We need each other because we need second opinions. We always go to others, say, can you look at this and do you agree with my diagnosis? We can't function on our own at all. So if you don't have that relationship in your team, it's really difficult, and the department doesn't progress as well. And you can't provide quality, safe healthcare if you are in a team like that in the theatre, in a ward. If there are problems and if there are conflicts like that, you can't give the best treatment to your patient, and you damage the reputation of your hospital. And then finally, you lose the trust and confidence the patients have in your healthcare system and your hospital. So when people behave unprofessionally, what we do is, first we have a very informal chat with them, get them to your office, and then I would chat with them and say, this has happened, so it's not so good. Can you change your behavior? That's a very informal thing. We don't document anything. No one is taking minutes, and so we see if there are changes. And if it happens again, and if it's a pattern, then we do awareness intervention. And if the pattern persists, we have to do some sort of action, some sort of authority and intervention. And then if nothing works after multiple attempts, you have to intervene and do a disciplinary procedure. And if you go down the disciplinary route, you can also end up going through dismissal as well. I also wanted to mention a bit about handling social media. I think I mentioned a bit. So social media is all over, not like the days that we were medical students. You have to handle social media very carefully. You cannot break confidentiality. And I've seen surgeons putting, well, there is one surgeon that I see on social media. Every day, the surgery that he does, he puts photos of all the things that he does on the social media. I think it's your choice, but you have to maintain the confidentiality. You can't use patient identification details unless the patient gives you the permission. And it's not a good thing to give statements on behalf of a institution just because somebody comes to you. And in my hospital, like if a BBC reporter comes to me and asks about something, I'm not going to give a statement because I may not know the entire situation, and I need to discuss it with my management. So if people just go to social media and give all sorts of opinions, and you can see how it's affecting the public and the public image, the image you have within the public. This slide, sorry, this one I included actually recently, yesterday or the day before, after I went to see one of my friends. My friend is my age, had a stroke, and has been in and out of this hospital for 1.5 years, like nearly, and her sister is looking after her. And my friend can just now barely manage to sit, can't talk as well a little bit after the stroke and management. So the sister is also a UK citizen. She's here looking after the sister for 1.5 years now, which is a great thing. I went to see them a couple of days back, and she said, this is the younger sister of my friend who is sick. She said, I can write a book about my experience in the Kandy Hospital. They've had treatments in our city, Colombo as well. She said, I can't believe I can write a book if you want to know. And I said, why? She said, oh, I think if people can hear me. Yeah. She said, when I go to doctors with my sister, I can't ask a question. I said, why? Every time I ask a question about my sister, the doctors get offended. They give me this look and they ask me, are you a doctor? And then I say, no, I'm an accountant. And the expression is like, why are you asking questions then? You are not a doctor. So like, if you're not a doctor, don't question a doctor. So being, and then she said, I don't know why, but I want to know because my sister can't speak. She's paralyzed and I'm looking after her and I need to know about the medication and her condition. So do the patients have a right to ask questions? All the patients have the right to be listened to and to be given the information they need to make a decision and the time and support they need to understand it. Do you give the time to your patient? Do you let them speak? Do you let them ask questions? You should. You're obliged to answer those questions as well because they matter in decision making. Who's making the decision? You or the patient? It's the patient who's making the decision. It's not you. What you can do is offer treatment to a patient. You can explain to the patient and say that, yes, you have a cancer. For example, I talk about cancer because I'm a pathologist and I work with surgeons. You can say, yes, you have a breast cancer. The best treatment for you is surgical excision followed by chemoradiotherapy. This is what we can offer. Do you want to take the treatment? And the patient, if like the patient who has had those personal beliefs about religious things, can say, no, I don't want to take your treatment, thank you. Or they say, yes, doctor, please take my cancer out and give me the treatment. The decision is made by the patient because the body that you treat belongs to the patient and not to you. You don't have the right to make a decision on behalf of a patient. And if the patient can't make that decision, mentally not fit to make that decision, or physically, like my friend who can't speak, then there will be a carer who will be in charge of their care. So when to show professionalism? We have to show professionalism at all times, not when you're on spotlight talking to media or something like that. When you're in front of other people, you can be just nice and professional, and then when you're not in the spotlight, you go and do something completely different. That's not a professional behavior. It has to be all times. When you're with patients, when you're with colleagues, when you're with the other staff members, and that helps to build confidence, trust, and respect. And that is critical in delivering safe and effective healthcare. So these are some of the things that I found as good qualities of a health professional. You can be productive, develop a professional image, take the initiative, maintain effective work habits, manage time effectively, demonstrate integrity, provide excellence, and be a problem solver. All these things are good when things are all going well. So what do we do when things go wrong? For example, Dr. Nandana did a presentation about anaphylaxis, and if like somebody you gave a injection and the patient died, what do? You blame the nurse who gave you the injection, or it wasn't me, I only gave the injection but you gave it to me, so you are at fault, not me, I didn't do anything wrong. Or you say, I just did a mistake. So there are human behavior. I've seen two sides. Some people deny. Denial is the phase some people go through. Some people just accept it. So you have to accept if you have done a mistake. Have you not done any mistakes, any of you all, during your careers? I think there are senior people, there are junior people. I think we all have done mistakes. You have to admit and you have to apologize. So there is a thing called duty of candor, and some people may have heard of it. When you have done a mistake or an incident has happened in our departments, we have to report that as an incident on a system called DATIX. And then they go to clinical governance meetings, they investigate these incidents, do root cause analysis. And what we do is, we are not going to punish anyone for doing a mistake, a genuine mistake. We are going to learn the lessons from the mistake that we did so that we will not do it again. We will make corrective measures so that it will not happen again. So duty of candor means every healthcare professional must be open and honest with patients and people in their care when something goes wrong and their treatment or care causes or has the potential to cause harm or distress. And healthcare professionals must be open and honest with their colleagues, employers, and relevant organizations, and take part in reviews and investigations when requested. So we have to be honest when something goes wrong. You can't just hide it. And also, if people want to raise concerns where appropriate, you must support your colleagues to raise concerns. You should not stop anyone raising concerns about other people, other colleagues, or things like that. So this means that a healthcare professional must tell the person, a patient, when something goes wrong. You have a duty to let the patient know, I have done something wrong to you. And then you have to apologize to the patient. I'm so sorry, that was a genuine mistake, I did. and then offer an appropriate remedy or support to put matters in right. So I can do this, we can do that, this is what we can do, and explain fully to the patient the short and long-term effects of what has happened. So this is duty of candor is a very important thing that we as doctors have to follow when things go wrong. So the final slide is just a brief thing about litigation and struck off from GMC in UK. It's not uncommon in UK. I have personally got involved in 3 cervical screening incidents. They were not my mistakes, but they were the screeners who missed some borderline abnormalities in smears when they screened. But as the lead, they all come to me, and then I have to answer to the trust litigation team and all. So what we do is usually we settle things out of court, because it's so expensive if the case goes to the court and the patient wins. It is so much more expensive. So the amount spent on claims in 2021 to 2022 by NHS is £2.5 billion. NHS resolutions are the people who deal with all these claims, and the amount given to them in last year was 85.2 billion, and it's been increased to 128.6 billion. So that much they pay for claims made by patients. And there were 24 doctors over 5 years got censured over medical record breaches. And this is the common thing, confidentiality. And there are so many other examples that I have seen. It's not uncommon. So in summary, quality and safety of healthcare we provide to our patients is very important, and the aim should be to give the best possible outcome. And professionalism should be in the heart of every healthcare professional to give best patient experience and outcome. I hope you gain something out of this presentation, and if everyone can take one message from this presentation to change, to become a better person than we were yesterday, I think that should be the aim. And thank you very much. I would like to thank the President and the Executive Committee of PEMSA and the President and the Executive Committee of KSM for giving me this platform to speak about, and all the participants who stayed until the end of this presentation. And I hope truly that you all gained something from this presentation. And the last slide is our Executive Committee of PEMSA UK. The gentleman in the white jacket is the President, Dr. Ashan Gunratna, and you can see me in pink. Actually looks like pink is my favorite color. I'm the Secretary of PEMSA UK. We don't have treasurer here in this picture, and the rest are the Executive Committee of PEMSA UK. So on behalf of PEMSA UK, thank you so much for listening and giving me this opportunity. Thank you.